Hello, guys, welcome back to Clinically Clear. Today, we'll be covering another very important topic, that is paranasal air sinuses. Now, what are paranasal air sinuses? These are sinuses, right? So, these are air filled cavity. Within the bones of the skull, you have certain air filled cavities known as paranasal air sinuses. Now, based on their drainage with respect to the ground lamellae. This ground lamellae I have covered in a previous video regarding the anatomy of internal nose, in the lateral wall to be precise. So based on its position and drainage with respect to the ground lamellae, you can classify them into anterior group of sinuses and posterior group of sinuses. Anterior group of sinuses, very, very important. Anterior group of sinuses, you have three. You have the frontal, you have the maxillary, and you have the anterior ethmoidal. Posterior group of sinuses, you have the sphenoid sinus and the posterior ethmoidal sinus. So this is about classification. First, let's go one by one. Maxillary sinus. This huge sinus you can see here, that is the maxillary sinus. Now, the maxillary sinus, this diagram is very, very important. The maxillary sinus is the largest sinus. That is 15 ml capacity. 15 ml capacity is the largest sinus. It is also known as antrum of Highmore. We have two maxillary sinuses which are symmetric in nature, the only sinuses to be symmetrical in nature. Now, they are pyramidal in shape. The pyramid is directed outwards. As you can see, the pyramid is directed outwards. This is lateral, this is medial, this is superior, this is inferior. So the pyramid is directed outwards. You have outward directed pyramids where the apex is directed towards the zygomatic arch and the base is towards the lateral wall of the nose. The base is towards the lateral wall of the nose. Yeah, the base is towards the lateral wall of the nose. Then that is the pyramidal shape. Now, here you can see the roof is formed by the orbit. The floor is formed by the palatine process of the maxilla. The posterior wall is formed by the pterygopalatine fossa. The anterior wall is formed by the facial process of maxilla. The apex directed towards the zygomatic arch and the base is the lateral wall of the nose. Maxillary sinus is the first sinus to appear on X-ray and it is present at birth. Understood? Then let's come to the drainage. Drainage. Maxillary sinuses has its own ostium and it has another second additional accessory ostium. Both drain into the infundibulum. As you can see here you have the infundibulum. Both drain into the infundibulum and then via the hiatus semilunaris, they drain into the middle meatus. Do you understood? So both of them drain into the infundibulum, then via the hiatus semilunaris, they drain into the middle meatus. The mucociliary clearance in maxillary sinus from all sides of the sinus is towards the ostium. All the secretions, they always get cleared towards the ostium from all parts of the maxillary sinus. Okay, so this is about maxillary sinus. Next, come to the frontal sinus. Now, frontal sinus is the most superior sinus. Frontal sinus is located in between the inner and the outer table of the frontal bone. Frontal sinus, you have two frontal sinuses which are asymmetric in nature, and very, very important, you have a sinus septum. Between the two frontal sinuses, you have a septum, a very thin bony septum known as intersinus septum. Now imagine anteriorly what you have the skin on the forehead. Posteriorly what do you have the frontal lobe of the brain. Anteriorly skin on the forehead, posteriorly the frontal lobe of the brain. Roof, frontal bone, floor, orbit. Simple relations. Frontal sinus is the last to appear on X-ray and is absent at birth. Could be an MCQ question. The last sinus to appear on X-ray and absent at birth is frontal sinus. The first to appear on X-ray and present at birth is maxillary sinus. Now, the drainage of frontal sinus has a special hourglass shape, hourglass appearance. That is because from the frontal sinus, it is drained into the sinus ostia. Then the sinus ostia further goes into a frontonasal duct or the frontonasal recess, which is again wide. So frontal sinus, which is a cavity, sinus ostia, again you have a recess or a duct known as frontonasal recess. This gives it an hourglass shape. This frontonasal recess opens into the middle meatus anteriorly via the infundibulum, middle meatus. Now, what else opens into the infundibulum? The maxillary sinus. So, frontal sinusitis infection, because infected secretions are drained into the infundibulum, where you also have the ostium of the maxillary sinus. Frontal sinusitis can commonly spread to the maxillary sinus, causing maxillary sinusitis. Now, the mucociliary clearance in the frontal sinus is a bit different compared to the other sinuses. That is, from the sinus, all the clearance is first towards the sinus septum. This is the medial wall, right? The sinus septum. So from there, it gets cleared along the roof, along the lateral wall, and then into the sinus ostium and is drained out. So it goes all the way around via the sinus septum to the roof and then to the lateral wall. Whereas in maxillary sinus, everything all at once drained into the sinus ostium. Now, one very important thing, the mucus secretions can get recycled within. Not all of it gets drained via the ostium. Some of the mucus secretion gets recycled within the frontal sinus. Okay, so this is about the clearance. So this is about the frontal sinus. Then let's come to the ethmoidal sinus. Now, ethmoidal sinus, you have 3 to 18, very, very important, 3 to 18 thin air-filled cavities in the ethmoid bone. Let's come back to this diagram. So here you can see these ethmoidal air cells. So this is nothing but ethmoidal air cells. Now, what is the boundaries? See, here you can see the roof. This is a depression in the ethmoid bone known as fovea ethmoidalis. This forms the roof. What is the lateral wall? Lateral wall is the orbit. See, this is the eye. This is where you have the eye in the orbit. So lateral wall is the formed by the medial wall of the orbit, also known as lamina papyracea. So roof is formed by the fovea ethmoidalis, a depression in the frontal in the ethmoid bone, not nasal bone. Apologies for the mistake. Then you have the lateral wall formed by lateral wall of the ethmoid sinus, which is nothing but the medial wall of the orbit formed by the lamina papyracea. Now, once again, the anterior ethmoidal cell can be divided into anterior ethmoidal, the ethmoid sinuses can be divided into anterior ethmoidal air cells and posterior ethmoidal air cells. Posterior ethmoidal air cells located posterior to the basal lamellae. So once again, based on the ground lamellae, you have posterior ethmoidal air cells and anterior ethmoidal air cells. So anterior to the basal lamellae, anterior ethmoidal cells. Out of this, the anterior most ethmoidal air cell is agar nasi. Then you also have other ones like bulla ethmoidalis, supraorbital cells, frontoethmoidal cell, and Haller cell. Haller cell is the largest anterior ethmoidal air cell. Posterior ethmoidal air cells are also known as onodi cells. Very, very important. Anterior ethmoidal air cells drain into the middle meatus. Posterior ethmoidal air cell drain into the superior meatus, and from there, as we know, all the sinus secretion and nasal secretion, the mucociliary clearance is towards the nasopharynx. Understood? So anterior ethmoidal air cells, agar nasi, bulla ethmoidalis, supraorbital, frontoethmoidal, and Haller cells, they all drain into the middle meatus, whereas posterior ethmoidal air cells, they drain into the superior meatus. So this is about ethmoid sinus. Now let's come to the most posterior sinus, that is sphenoid sinus. Sphenoid sinus. So what do we have in sphenoid sinus? In sphenoid sinus, we have two sinuses that are separated by a sinus septum. So when two sinuses are separated by a sinus septum, which other sinus was separated by sinus septum? Frontal sinus. Frontal sinus also had a sinus septum. In sphenoidal sinus also you have a sinus septum. And here also they are asymmetric. Now let's look at the relations. Now relations, first of all, when we are looking from the front view, you have superior, inferior, and here you obviously have lateral, and this is on the other side as well. So you have four structures. You have this superolateral ridge formed by the optic nerve. You have internal carotid artery laterally. You have the maxillary nerve and the Vidian nerve. So optic nerve form the superolateral ridge, internal carotid artery, maxillary nerve, and Vidian nerve. Then let's come to the superior relations. Superior relations, you have, see here you have the two sphenoid sinuses. Sphenoid sinuses, superiorly you have a you have the sella turcica, a depression in the ethmoid bone, a cavity in the ethmoid bone, a cavity in the sphenoid bone, my bad, which contains the pituitary gland. And on either side, you have the cavernous sinus. The cavernous sinus contains, passing through the cavernous sinus, you have, passing in between the cavernous sinus, you have the internal carotid artery and the third cranial nerve, the fourth cranial nerve, and the sixth cranial nerve. This is about the relations of sphenoid sinus. And the clearance, the drainage of the sphenoid sinus is through the sphenoethmoidal recess. Now, one very important thing, sphenoethmoidal recess, it is a posterior group of sinus, but it does not drain into the superior meatus. It drains medial to the superior turbinate, not in the superior meatus, but above and medial to the superior turbinate. This is about sphenoid sinus. It drains medial and superior to the superior turbinate. So we have the four sinuses: maxillary sinus, frontal sinus, ethmoid sinus, and sphenoid sinus. Now let's come to the physiology of paranasal sinuses. Now this is a little interesting topic. Basically, when we inspire, what happens? The air flow through the nose is very fast. You have quick airflow through the nose. So whenever air flows in very quickly, you have negative pressure. The pressure in the nasal cavity reduces. So what happens? Air gets sucked out of the sinus. So air leaves the sinus. So during inspiration, fast airflow to the nose, so negative pressure within the nasal cavity. So air moves out of the sinus into the nasal cavity. Whereas during expiration, the formation of eddy currents, these eddy currents ventilate the sinuses. So the ventilation of sinuses is opposite to that of lungs. When we inspire, lungs are ventilated, but sinuses are not ventilated. When we expire, sinuses are ventilated because of the eddy currents. So this is about ventilation. Now let's come to the functions of paranasal air sinuses. Basically, it lightens the weight of the skull. You don't have solid bone everywhere. You have pneumatic bone, so it lightens the weight of the skull. It increases surface area for humidification and olfaction. As we know, olfactory mucosa helps in olfaction, and evaporation of water from the sinus mucosa, the nasal mucosa, humidifies the air, so it increases the surface area, and it provides vocal resonance. That is, it provides timbre to the voice. That is exactly why when we have sinusitis, when we have rhinitis, the voice sounds different. It sounds hyponasal and does not have any timbre to it. That is because this paranasal air sinuses provide vocal resonance, and they also act as mechanical buffers and thermal insulators. Whenever we inhale any hot air, then it should not damage the brain. It should not directly go and cause, let's say we inhale any very hot air, then it should not go and increase the temperature within the brain, or any trauma to the face, then it should not go and cause injury to the brain. So they act as mechanical buffers or thermal insulators, protection to the brain. So simple functions: lightens the weight, increases surface area, protects the brain from via thermal insulation, mechanical buffer, and provides vocal resonance. Ventilation of the sinuses is opposite to that of the lungs. So that is it for paranasal air sinuses. Basically, this diagram is very important. You have the nasal septum, you have the inferior turbinate giving rise to the uncinate process, you have the orbit, you have the frontal bone, then the ethmoidal bone, fovea ethmoidalis, the ethmoid air sinuses, then you have middle turbinate, you have the hiatus semilunaris, you have the maxillary sinus. So that is it for paranasal air sinuses anatomy and physiology. I hope you guys enjoyed the video. If you did, please do like, share, and subscribe. Thank you for watching.